I'm pleased to join you this morning on this discussion on menopause. When a request was posted by our colleagues who were in this meeting, of course, it actually raised some spanners as to what is it. It is true that menopause had been neglected, and we have never, as a country, had discussions. Menopause is not just a woman's issue. It's a public health imperative. It's an economic issue. It's a human right issue. Globally, the average age for menopause ranges between 45 to 55 years. In Kenya, one in every 4 women will spend more than 40% of their lifespan after menopause, which is almost half of a woman's life. Yet, our health systems treat this phase as it doesn't exist. Unmatched menopausal symptoms may contribute directly to osteoporosis, cardiovascular diseases, diabetes, depression, genitourinary symptoms, and many more. Our researchers and academic institutions need to incorporate menopause into curriculum and conduct studies on menopause that will inform policy. The National Social Health Authority has not addressed or covered menopausal issues. Policy document. We have the reproductive health policy. In reproductive health supports menopause, though the implementation of the policy is a challenge. Community sensitization on women's preparation and awareness of menopause framework structures is supposed to be in place to prepare women transition to menopausal stages. Healthcare professionals in health facilities are not well prepared to handle menopause. I remember when I was when I used to practice as a gynecologist, having gone through the hands of Dr. Han Kiara, I still had challenges in managing menopause. Because one is that you can accurately diagnose menopause, but the medication was that complex, and more so, not available. So I think this is now, this meeting, in my view, forms like an inaugural discussion for menopausal sensitization and policy guidelines to be in place. On the same note, Judge Njoki has also mentioned the affordability. I think all these things, therefore, will have to be packaged so that we talk about affordability, availability, and management of menopausal symptoms countrywide. So with this, we are therefore, our office, we are going to make sure that we facilitate this discussion moving forward in terms of coming up with the policies and any other issue which needs to be done. Our office is going to be instrumental on this because it's clearly one of the components of our deliverables in reproductive health, not to mention others like reproductive cancers, infertility, and many others. I want to, from here, I'm going to constitute a committee to be in a position to drive this agenda forward, so that in the next few months, we are somewhere and we have policy guidelines to guide the country, and more so the counties. As we are doing this, of course, we are doing with very many other things. You know very well that right now we have been doing a lot of sensitization on awareness. Every woman, every newborn, everywhere, acceleration plan to make sure that we accelerate reduction of maternal newborn deaths in the country, to be in tandem with the world and be in a position to achieve our 2030, Vision 2030 global, Kenyan targets. We have our Kenyan targets, and we are really working on that. You are going to hear more about that. Still part of improving the health of women. At the same time, Kenya is privileged to host the International Maternal Newborn Health Conference here in Kenya. It will happen in March next year. And we would like, therefore, to call for your support to participate, get abstracts ready. It's almost time to call for the abstracts so that you can present presentations which are there. It will be held here in KICC, and yes, I'm part of the committee members, and we are going to constitute national committee members to be in a position to plan for that event. So with those, I don't want to say many more again. We are ready to facilitate all this, and I'm happy whenever you are called upon, you are ready to come in, facilitate, support technically, and in all other resources. Asanteni sana. Have a fruitful discussion.